Attach QuickConnect Carrier. If necessary, rotate swivel to desired quadrant. Push carrier driver forward to expand carrier arms before attaching to retainer. Tighten by turning carrier driver clockwise. Place on tooth and tighten. Place separator wedges. Complete restoration. QuickConnect Anatomy Band, tab techniques. Place on tooth and tighten. Place separator wedges. If using the tacking method, also apply bonding agent under the tabs. Apply flowable composite under tabs. Pull tab with a probe and cure while pulling. Alternately, don't tack down, just pull tabs while curing increments. Fill the proximal box with flowable composite, pull the tabs with a probe and cure while pulling. Final increment is placed, the tab is pulled and then light cured. This method allows you to restore both mesial and distal cavities simultaneously, thus saving time. Reattach carrier and then turn carrier driver anticlockwise to loosen. Remove separator wedges. Debond metal foil from composite. Use a strong and sharp hand instrument or number 12 scalpel to pry off composite holding the tabs in place. Remove QuickConnect Anatomy Band. A number 12 scalpel can be used to remove freshly cured composite flash. Trim and polish final restoration.